All right, guys, so we're going to get started. Thanks for bearing with me. Thank you for being here at 7:30 in the morning. I appreciate you all. Again, my goal here today is just to kind of give you guys a little bit of an introduction into foam rolling, why we're doing it, why we're not doing it, because again, there's a lot of misinformation about what foam rolling does and doesn't do for you. So I'm going to do my best not to blab on too long about this so that we can spend the majority of our time kind of going over some of the exercises. All right, so we're gonna get going foam rolling. Everybody's favorite activity. I almost called this, why do you hate me? Because I feel like this is the question that my patients ask when I first put them on a foam roller is why are you doing this to me? So we're gonna get into that a little bit today. First of all, what doesn't foam rolling do? Foam rolling does not break up scar tissue. When we're talking about foam rolling, we're specifically trying to target fascial tissue. And so we'll talk kind of quickly about what fascial tissue is. But fascial tissue is super strong and withholds a lot of stress. That's kind of the point of it. And so the idea that a foam roll, even with our body weight on it, could break that tissue up or break those adhesions up isn't really true. So that's one thing that I think it's kind of an idea that kind of took a lot of ground. We call it myofascial release, but it's not actually what we're doing here. So we're not breaking up scar tissue. Foam rolling also doesn't make muscles more pliable. It would be awesome if it did, but unfortunately, again, that's just not enough force to this really strong tissue to do that. And then also foam rolling doesn't make you look like that lady, unfortunately. Again, it would be great if it did. In researching this, came across all kinds of crazy websites, and people will tell you that foam rolling can break up cellulite, that it can, it can make you wake up with perfect hair in the morning. It doesn't do any of that kind of stuff. So I apologize. You guys are not going to look like this woman just because you foam roll. So they're laughing at me here. So what does foam rolling do then? We know that it can lead to a reduction in muscle tone. And so when we talk about muscle tone, we talk about muscle length. Those are two different things. And a lot of times we talk about flexibility, but that's different than addressing muscle tone. A muscle can be long, but have increased tone and still feel tight. So you have a lot of people who will come in and be like, my hamstrings are like so tight and I'm not flexible in my hamstrings. And then you lay them down and you take their leg up and they can almost like touch their knee to their nose. That person doesn't have a problem with the length of their hamstring. They have a problem with the tone of the hamstring. And that's true of any muscle. So we know that using a foam roll can help decrease the hypertonicity in a muscle. Foam rolling can also help neuromodulate pain. And that's a fancy way for just saying foam rolling can help you feel less pain. They've done studies where they look at people and they kind of figure out how much tolerance they have to pressure. And then they have them foam roll and then they press on that spot again and it doesn't hurt as much. So that tells us it can help increase your tolerance to pressure and it can help neuromodulate. So in your brain, kind of change the pain that you're getting in that area. We also know that it can decrease perceived soreness and it can, again, increase your pain threshold after exercise. So what that means is that you'll have improved recovery. So if you have had a really hard workout and you are having trouble like sitting down on the toilet seat, you're so sore, your legs are so sore that you're like, oh, like even this hurts. Using the foam roll can help decrease the amount of time that you experience that sensation. It's called DOMS. I'm sure you guys have heard that before, but it stands for delayed onset muscle soreness. And again, that is that like miserable, achy feeling that you get after a really good workout. And we know that using the foam roll can help decrease the amount of time that you experience that DOMS. We also know that foam rolling can help increase blood flow and water content to tissue. And that's really a lot of what we're trying to accomplish with the foam roller. So I've used the analogy, it's terrible, but I'm sure if any of you guys have been with me before, you've heard me use this analogy, that like when we're babies, our tissue is kind of like veal. And as we age, we sort of trend more towards like the beef jerky end. So our tissue just loses some of the water content as we age. And what foam rolling does is it can help redistribute that blood flow and that water content to those tissues. So it's really good, like first thing in the morning, if you're feeling stiff and that kind of like, ugh, like I just got out of bed and everything's feeling creaky and sore, foam rolling can be a really good antidote to that. We also know that in the short term, foam rolling can increase flexibility. So again, we talked about tone, we talked about length. So foam rolling, it's interesting, even though foam rolling isn't really addressing length, it can help improve your flexibility in the short term. And again, we think that's because of that increase in the blood flow and in the water content. What we found is if you do the foam roll consistently for longer than 2 weeks, you'll actually see some longer term gains in your flexibility as well. And these gains are improved if they're done in combination with stretching. So stretching has kind of gotten a bad rap in recent years. There's been a lot of press about how stretching decreases power output and things like that. But stretching is not the devil. I just want to say that. Stretching is really good for you, particularly if you do have issues with your muscle length. And I think the studies that came out that kind of popularized that idea that stretching was bad, one, it was done primarily on healthy subjects, so not people who had injuries. And also, it was looking at really specific things like power. So they would have somebody jump up in the air as high as they can, and then do some stretching, and then jump up in the air as high as they could. And you know, lo and behold, they couldn't jump as high after they stretched. But most of us are not professional basketball players or competing in the high jump in the Olympics. So for us, stretching is probably not the worst thing in the world to do. And even for those guys, it's still great for them, just maybe not right before they compete. So foam rolling is not meant to take the place of stretching. And when done in conjunction with stretching can actually be even more beneficial for you. Also, foam rolling can't make you look like this lady, which is probably a good thing. All right, so we talked a little bit about fascia. What is the fascia? It's kind of a fancy thing that people talk a lot about again. Fascia is essentially a type of connective tissue. Its job is to attach, stabilize, enclose organs and or other tissues. So if you've ever seen a chicken breast and you peel that little thin layer up off the top of it, that is fascia. It helps with force transmission. So if you think about big multi-joint movements, think about taking the case of water from the bottom shelf of the grocery store, picking it up, and then carrying it into your cart. That involves your lower extremities, your core, your upper extremities. That force has to be transmitted somehow from one part of your body to the other. So fascia helps with that. It also, we know, contains a lot of nerve endings, which means that it can be a possible pain generator for a lot of people. And then we also know that it's thicker in some areas and it's thinner in others. So if you look at this picture kind of off to the right of my screen, you'll see these areas where there's more of this kind of white stuff and less of the red stuff. Those are thickenings of that fascial tissue. So fascial tissue is all over your body, but it's thicker in some areas and thinner in others. What we don't know about fascia is actually probably as much, if not more, than what we do know. We don't know, or we don't have agreement on how many layers of tissue it is. And we can't even always agree on like what parts of our body are fascia. So the IT band is kind of a perfect example. And I took this picture so you could see it. The IT, oh, dang it, I just went backwards. Press the back arrow. There we are. So the IT band is this long layer on the side of this guy's leg here. That's your IT band. And some people will tell you that's fascia. Some people feel the IT band is more of a ligament. So even within, you know, all of our knowledge, there's still a lot more that we don't know. Oh, great question. So I had a question here about when used with stretching, should you stretch before or after rolling? That is an awesome question. You should stretch after rolling. So the foam roll will help increase your tolerance to stretching. So again, it gets blood flow to the area. It improves the water content or redistributes the water content. So if you do that first, you'll be able to stretch more. Good question. Thank you. Please, again, don't hesitate to answer questions. Do you need to warm up your body before rolling? Great question. No. Foam rolling is a way to warm up your body. So again, thank you. Great question. All right, sorry guys, I'm already taking longer than I wanted to. Sorry guys. So hard to find good help these days. Oop, and then I went forward again. Okay, so when should you foam roll? We just started to get into this a little bit. When you're feeling stiff or you're feeling tight, again, I think for a lot of people, that first thing in the morning is really hard, particularly as we start to get a little older. I know I don't hop out of bed as quickly as I did, 15, 20 years ago. So I think that as you find that that stiffness is sort of a more present thing in your life, that's a great time to use it. Before exercise, again, this was a great question that we kind of already talked about, but before exercise is a great time to foam roll. It helps warm up the tissues. For all you runners who are here right now, you know, we always know that that first mile is pretty miserable a lot of times, even when we're feeling good. So foam rolling is a way to kind of get you through that first part where you're feeling kind of stiff, you're feeling tight, you're feeling like the blood's not pumping yet. If you were to foam roll first, that would give you probably a little bit less time where you're feeling that. After exercise, again, we kind of talked about this a bit already, but after exercise, we know that it can help decrease the amount of time that you perceive that DOMS, that delayed onset muscle soreness. So foam rolling can be used before exercise to help prepare you for exercise. It can be used after exercise for recovery. So again, if you're an athlete, if you're somebody who's training hard, you're doing multiple training sessions multiple days in a row, or maybe you have a morning session and then an afternoon session, the foam rolling is a great way to help your body recover so that you can have more effective training sessions. Quick note, the best way to get rid of DOMS, that delayed onset muscle soreness, is actually more exercise. So just a quick plug there for any of my patients. If you're feeling sore from your exercises, do your exercises again and you'll feel better. Okay, how to foam roll. Again, this is an area where you can find people telling you lots and lots of different things. So there's a lot of ways to skin a cat. Sorry for that terrible analogy. But what you want to do is you want to choose the foam roller that's right for you, right? So you can find low density foam rollers. Those are typically the ones that are either white or kind of that marble colored most of the time. You can find high density foam rollers. They're typically black and they'll feel a little firmer if you try to squish them. And you can get the ones like the rumble rollers and the ones that have, they're textured, right? And so those are kind of like the most aggressive foam roller that you have. Sometimes, and we're gonna get into this a little bit, foam roller is not the best choice for you. Sometimes you wanna use a tennis ball or a golf ball or something else, depending on the body part that you're working on. So, but choose the one that is best for you guys. Everybody always asks, like, what's the best tool to use for X, Y, or Z? The best tool to use is the one that you're gonna use. So if you have a foam roller, it's got all the little knobby things on it and you get on it and every single time you're miserable, you're probably not gonna use it for a really long period of time. So get a lighter density foam roller that doesn't make you feel so miserable. Or maybe you start with a stick, which we're gonna show you guys here in a minute. When you're foam rolling, you wanna start with the least tight and least painful areas. So if you know, for example, like my glutes are always super tight and I can get on the foam roller and you know, in tears in seconds, not really. But I know it's my most painful area. So I start with areas that aren't quite as tight and aren't quite as tender, and then I move more to those. You can spend between 30 to 60 seconds in any one muscle group. Again, this is kind of where you have to feel out what feels good for you. If there's an area that you feel needs a little bit more love on any given day, then you spend more time there. One thing, and we'll talk about this when we start demonstrating the exercises, but I do like kind of telling people to roll back and forth over a small area. So a lot of these muscles that we're gonna foam roll are long, and it can really be a lot on your shoulders if you're rocking back and forth all over the length of the entire muscle as you're going. So I typically will tell people to take like a little chunk, like 6 inches of the muscle and kind of roll in that area, and then move the foam roller up again and go back and forth in that next 6 inches. Another tip is you want to roll slowly back and forth, so don't rush through it. And you also want to move in what we call multiple planes. So you're not always moving in the same direction. Fascial tissue is not all nicely aligned the way our muscles are. The fibers don't all run in the same direction. So if we roll in only one direction, we're not going to get the effect that we're looking for. Some common foam rolling mistakes, again, spending too much time in any one area. Just like anything else, there is too much of a good thing. That's a thing. So you want to find a tender spot and then just spend 10, 15 minutes there. Like you likely will just aggravate it more. Rolling over bony areas or bursa, that's generally not a good idea at all. Those bony areas have soft tissue that attach to them. And so if you take a soft tissue and it's got a bone on one side and then you're smushing it on the other side with the foam roller, you're generally not going to make that area very happy. And then bursa are like these fluid-filled sacs that help protect the soft tissue from that bony area, and they also don't really like being foam rolled. So if you end up with, you know, a lot of tenderness at a certain area, just do a quick kind of check there and palpate yourself and be like, oh man, yeah, that's actually a pretty bony area. I probably shouldn't be rolling right over that, okay? And then a foam rolling mistake, I almost didn't even put this on here, but foam rolling the IT band, there's a lot of mixed information about whether or not you should foam roll the IT band. Some people will say, don't ever foam roll the IT band. They think that the IT band, again, functions more like a ligament than fascia, and that you want that kind of tension in there to help stabilize your joints, particularly your knee. Other people say, well, shoot, if we know that we're not really deforming tissue, then who cares what it is, because we're not changing it that significantly. All we're doing is bringing blood flow and, again, water content and stuff to that area. I don't really, I kind of fall in the center on here, right? I think do it if it feels good. I certainly don't think that there's enough research to suggest that you should never, ever, ever do it. I also think that if you're not comfortable rolling right over that area, that you can probably still get a lot of benefit rolling over like the outer aspect of your quad and the outer aspect of your hamstring, and your glutes too. And I think you'll still see a lot of benefit. And again, the IT band is that really thick band of tissue right on the outside of your upper leg. So if you think about your femur bone, kind of where it goes from your hip down to your knee, runs all the way down the side of that. All right, sorry guys, I'm finishing up, I swear. Oh yeah, I'm done. That's all the talking I want to do. So we're going to go through quickly foam rolling options for soft tissue work, for joint mobility, and some other just random uses for the foam roller now. If you guys want to kind of do these with us as we go along, you're welcome to get up and find a place where you can get on your foam roller. If you want, you can also just kind of listen and watch right now, and then this is being recorded, so you can go back and watch it later and then practice the exercises at that point. Does anyone have any questions before we move on to some exercise demonstration? I've already talked way too long. Awesome. Okay, so we're going to get our camera set up, and then we'll demonstrate some exercises. Lovely. And now you guys see Cassie. She's our athletic trainer extraordinaire who's demonstrating for us today, so that I didn't have to talk and exercise at the same time. Okay, so Cassie's going to start out by just showing you how to foam roll. We're going to start with hip flexors and quadriceps. So your quads are that kind of meaty area on the front of your leg. There are actually 4 muscles to your quadricep. That's why it's called a quadricep. And so there's some that run more to the inside. There's some that run more like right over top of your leg. And then there's a little bit of it that runs more to the outside. One of the quad muscles attaches also above your hip. So it works as a hip flexor as well as a knee extender. So what you'll see Cassie doing right now is she's not just staying like right over top of her legs. She's kind of rotating out to the out a little bit to get that outer band of your quad. She is going right over the top of it to get the, oh, and now she's going to the inside to get the medial or the inner band of the quad. And again, she's doing kind of exactly what we like our patients to do, which is take like a little 6-inch area and roll up and down. And then once she feels like she's gotten some love to that area, she either moves herself or moves the foam roller and kind of goes up to the next 6 inches. Let's see, okay. I think so. If anybody can't see, maybe just give us a little shout.
Yeah, make sure they can see it well.
And then the hip flexors are kind of a tricky area. This is an area that I think is tight on so many people because so much of what we do involves our hip flexors being in a shortened position. So to get the hip flexors, you're gonna wanna have one leg kind of on the foam roll and one leg off of it to support your weight. And then I think this is probably kind of hard to see, but Cassie has, ooh, hi everybody. Cassie has kind of angled that foam roller. So it's right kind of in the crease of her hip right there. And again, she's just gonna roll back and forth over that. And we're not really spending as much time as we would typically on any given area right now. Just because there's a lot we want to show you. But again, you can spend 30 to 60 seconds on any one spot. Yeah, I think we're just gonna keep here. Cool, so again, quickly, that was quads and that was the hip flexors. The big take home for the quadriceps is that you're not just going straight over the top of your leg, even though it does seem like that's kind of where the majority of your issues are gonna be. You wanna make sure that you roll a little bit to the inside and you roll a little bit to the outside as well. Okay, IT band. So again, the IT band is that really thick area of tissue on the outside of your leg. And this is the one that some people will say never foam roll. I think foam roll if it feels good. So you'll be on your side. This is also a really tender area. So for a lot of people, getting right into this, like as the first thing you roll, is probably not the best idea. But once you've been able to loosen up some of the structures around it, and again, you're gonna be on your side, use your top leg to support your body weight, and then your bottom leg is on the foam roller. And again, you can see how Cassie's arms are kind of working to push herself back and forth. And so to make it a little easier on yourself, you take just like a small area, maybe 6 inches or so of the muscle, you roll back and forth in that range. And then you can either move your body or move the foam roller to get like the next area of tissue. Awesome. So again, if you're not comfortable rolling the IT band for whatever reason, if you roll the outside band of your quad, kind of as Cassie's going to show now, a lot of those fibers blend in with that IT band. So if you think, I can't tolerate rolling my IT band, or I'm not comfortable doing it, if you spend some time really on the outer edge of your thigh, both on the front and then also on the back. So Cassie, if you don't mind doing maybe just lateral hamstrings a little bit. Rolling those two areas, you're gonna get a lot of those fibers that come into contact with the IT band, and I think you're still gonna see really positive results from that as well.
So also notice I'm like turning my body, so I'm not all the way on my side, but I'm also not just straight on the foam roller. So angling my leg.
Perfect. Yeah, kind of like a 45-ish degree angle. Good. And then hamstrings also. The hamstrings, there are multiple muscles that make up the group of the hamstrings. So some people, kind of as Cassie pointed out, will go just right over top of the foam roll like this. And that certainly will get some of the hamstring muscle group. It won't get all of it. So the hamstrings are another one where you want to turn to the inside, kind of again at that. So you're sort of at a 45-degree angle on the foam roll. So you get those medial bands of the hamstring. And then you can be right over top of it, and then you turn to the outside to get the lateral bands of the hamstring. So again, moving in multiple planes, not just always in the same area. And again, she's kind of taking like 6 inches or so and then readjusting the foam roller. Another area that tends to get really tight on people is where those hamstrings insert onto the ischial tuberosity, or your sit bone back there. So this is an area that I think is great to roll, but you want to be careful because again, the ischial tuberosity is a really bony area with a bursa, a fluid-filled sac that helps protect those muscle insertions from the bone. And so if you do roll that area, just be careful that you're not going back and forth over it. And Cassie's kind of shown a good position to get that. This is typically the next position that we'll move into if we're foam rolling the legs, because this is a great way to get that like insertion of the hamstring onto the ischial tube, and then also your glutes. So again, if you're a runner, if you pick up heavy things and put them down again, if you're lifting kids a lot, like chances are your glutes get kind of sore from time to time. We've all heard of the piriformis and how that can cause all kinds of issues. So to address that particular muscle group, what you're going to want to do is sit on the foam roller and then cross one leg over the other in what we call a figure 4. So if you look at Cassie, if you look from the top down, it almost looks like the letter 4. The number 4. So she gets in that figure 4 position and then shifts. Oh, she's gonna move. Speaking of snaps, crackles, and pops.
Yeah.
Is it?
Yeah.
Okay, we'll go with this. Okay, so her leg is crossed over, and again, she's shifting her weight to the side of the leg that is crossed. So her body is angled. She's using her arms to kind of push herself back and forth, but then her lower body is kind of twisted so that her weight is really more on the side of the leg that's crossed, and she's rolling back and forth and getting that glute muscle group. All right, last but not least for the lower extremity, we're going to show the calves. The calves are, I'll be honest, using the foam roller on the calves is not my favorite. If you guys like it, absolutely go for it. For me, it's a lot of load on the shoulders. So she's now got to support most of her weight on her arms and hold her butt up off the ground as she foam rolls the calves back and forth. So typically what I'll recommend for people is instead of using the foam roll, I'll have them use what's called a peanut. And a peanut, you can buy these places. You can also make your own just by taping 2 tennis balls together. If you need a peanut, feel free to come by. We'll happily tape one up for you. We have tennis balls for days here. So she now has those 2 tennis balls that are taped together. And that's great because you can really get both heads of the gastroc at the same time. So there's a medial head and there's an inside and outside portion of the gastroc. And she can get both kind of portions of that at once. And she's using that tennis ball to roll back and forth. And you can see it's just a lot less load on her arms. And same thing, she'll use it in a little spot and then she'll kind of move it, go down closer to her Achilles tendon. But this is a great option if using the foam roll on your calves just really kind of wears out your shoulders. All right, so for upper body, typically we use the foam roller for a few things. So we're gonna start showing the lats. The latissimus dorsi is a huge muscle group. Influences how you use your core, how you use your arm. So it's a really good one to foam roll. It's tight on a lot of people. So what you'll see Cassie doing is she's on her side or maybe even angled a little away from the camera right now. So kind of a little bit more towards her back. She's got her arm over the foam roller and she is again sliding back and forth kind of in the armpit area and a little bit below it. Again, you want to be careful because your ribs are right there. And for some people, those are more prominent and kind of more tender structures. But that is a great one, particularly for anybody who's been doing any kind of upper extremity lifting, is sore. Sometimes even, I know my arms will get so sore that like I notice it running. So this is one I for sure try to do before I run. Triceps, next one, very similar position. So again, her arm is over the foam roll. Her body is kind of perpendicular to the foam roll or maybe just a little bit angled away from the computer if that feels more comfortable. She's doing almost the exact same thing, but now she's just getting more into the arm. And again, where that muscle inserts. So kind of in the armpit area, a little bit down the arm. She can even go further down the arm if she's feeling more sore through the belly of the tricep itself. Awesome. When it comes to doing some of these areas too, just one thing to note, if you find a spot that's feeling ouchy, it kind of makes you like squinch up your nose and like close one eye a little bit and you're thinking, ugh, like, again, why did I sign up for this? That's where you spend a little bit more time, okay? Again, we're rolling through this, no pun intended, kind of quickly right now. But in a perfect world, when you're doing this, if you do find a spot and you're like, oh man, that really got me, like that's where you spend more time. Oh, okay, rhomboids. So rhomboids are the muscles that run in between your shoulder blades, and there's a couple ways you can do this. I think we decided this way. Yep. So for this one, you're going to kind of lay on the foam roller. You want to make sure that you're supporting the weight of your head with your hands. So don't just let your head kind of flop back while you're on it. Yeah, that's not so good. So you need to have a little bit of strength through your core as you're doing this, so you're not flopping over. But again, the rhomboids run in between your spine and your shoulder blades. And so her weight right now is kind of right in that area. And she's shifted a little bit to one side. So right now she's kind of biasing the left one. And now she's rolling towards her right side and biasing the right one. This is great if you spend a lot of time hunched over a computer, like a lot of us these days. This will feel really good for you. Okay, and then lastly with this, we're going to do the rector spinae. So for this one, yep, you can lie on the foam roll. So now she's got her bum and her head, which takes a little bit of finagling, but both from her hips up to her head, she's got her weight supported by the foam roll. Her arms are out to the side to give her stability. And she's just gonna roll back and forth. And this feels really good on those long muscles that run up and down the length of your spine. Oh, sorry, palm up or palm down for triceps rolling. More like this almost. So kind of like a neutral position. I feel like I wanna do like finger puppets right now. Okay, So that was quickly some of the ways that you guys can use the foam roller for soft tissue. Some other things that we like to use for soft tissue. Again, we showed you how you can use the peanut for your calves. The peanut we also love to use for a little area behind your neck and head called your suboccipitals. And these are these two little muscles kind of right at the base of your skull. And so, oh yeah, thanks Cassie, you're such a good model. If you have any kind of like tension headache that develops, particularly towards the end of the day, again, you've been like slouched over a computer all day long, you've been reading, you've been staring at your iPhone, this is an awesome thing to deal with those what we call cervicogenic headaches, or headaches that come from like a cervical origin. So she's got those two little tennis balls right up at the base of her skull, kind of where that knobby area on the back of your head is. It feels great. Cassie wants to spend the rest of the presentation just like this. So again, you can kind of nod your head up and down a little bit or rotate it from side to side to bias one side over the other. And then just move it up and down a little bit. She's using her hand to kind of adjust where it is on her head until, again, she finds that spot that kind of gives her that oof sensation. Sometimes you may even find that as you're doing this, that it recreates the headache sensation that you get. And that's okay. Again, you just wouldn't want to do it for too long. You don't want to give yourself a headache doing this. Awesome. Okay, other tools we like to use, I know this is a foam rolling lecture, but I just want to show you guys other options because again, the best tool for you is the one that you're going to use. So if foam rolling is not your thing, if it has been collecting dust in your closet and you're using it as a hanger for a while for your clothes, that's okay. The stick is also like a really great option that's maybe a little bit less aggressive at first. There are 8 billion versions of this on the Amazon and the interwebs that you can look for. This one is very conveniently called the stick. It's essentially a bunch of beads on some handles. And so you can roll that up and down any muscle group. And again, for some people, this is really nice because you can control the pressure a little bit more. It's easier on your arms. You can stand up and get like your booty with this. You can get your hamstrings. You can do your calf really nicely with this. You get lots of options with this guy. Thank you, Cassie. Other options for you, you can use a tennis ball, or you can use this fancy, you can use this fancy thing called the Theracane. And again, we're not like sponsored by Theracane or anything. This is just one other tool for some of the areas, like a lot of people, particularly have shoulder pain. We've talked about the rotator cuff a ton. So for that posterior cuff, the back of the shoulder blade, maybe you can face the wall. So Cassie's using this guy and it's got a little like nubbin on the end and she's just digging that into some of those areas in the back of her shoulder blade that are really uncomfortable. If you don't want to buy a special tool just for this, if you have a regular cane at home, you can put a tennis ball on the end of it and use it that way. This guy, if you do buy it, it comes with like 40 different things you can do with it. This is probably what I use it primarily for, posterior cuff and then also upper trap. So again, for folks that spend a lot of time wearing their shoulders as their earrings, as I like to say, kind of hunching their shoulders up a lot through the day, whether they realize it or not, this is super helpful. And again, this is called a Theracane. And hopefully they will send me a royalty check. Awesome. So the other thing we like to use the foam roll a lot for is joint mobility exercises. So again, anyone who's ever had any shoulder problems and has come to see me has probably spent some time doing some of these. Shoulder mobility, first of all, is also affected a lot by your thoracic mobility. So that middle part of your spine, when that is tight, that can actually influence how much range of motion you can get in your shoulders. So what I'll tell people to do is just put the foam roll perpendicular to you. And again, you're going to support the weight of your head with your hands and you're going to lean back over it and kind of come back and forth a few times. Oh, somebody wants to see this close up. Nope, you stay there. So Cassie's just going to kind of roll up and down on that foam roller. And then when she finds a spot that feels pretty stiff, she's going to like arch back and forth over it. So she's essentially extending back over the foam roll and then coming back up. And she's doing like a self-mobilization essentially. And then she's moving up a little bit, kind of finding another stiffer spot. Again, the important thing to remember about this is you really want to keep your head supported, your head and your neck supported with your hands, or you're going to tire out pretty quickly. Good. And then the other way we like to use this for shoulder mobility, you can actually lie on top of it. Support your head and your bum. And before we do this, this is the Theracane. We had some questions about what it looks like. So it looks like this. It's green. You can buy it at your friendly PT at ACAC store or on Amazon or probably many other places. So Cassie's going to run through a quick set of exercises right now that we like to do for shoulder mobility. The first one is called a hug. So she's bringing her arms out to the side. This really helps you get a nice stretch through your pecs, through your chest area. And then she's reaching across and trying to give herself a big hug. Each time she goes, she's switching what arm goes over top. And again, I'll typically have people do, I don't know, 15 or 20 of these. And then we're gonna do Tin Men. So you've got one arm coming overhead, and then they meet in the middle and switch. And again, you wanna be mindful at this point of how much of this motion is coming through your shoulders and how much are you finding that you have to kind of arch through your upper back. So Cassie, yeah, so see how right now, Cassie's really like getting a big arch through her spine to make that happen. That would probably be a good indication to you that maybe you've got some shoulder stiffness and you're borrowing from other areas to get that range. So at that point, you could try to actually like keep your back pressed flat against the foam roller and see how much motion you can get without letting your back come into it. And then lastly, snow angels. So she's got both arms up and she's pretend like you're in the snow and you're trying to make a snow angel. You're trying to keep your fingers on the ground as you go through the range. Cassie is young and, you know, not injured, so she's able to do it super easily. If I was on there, you'd see that right about there, yeah, my fingers would kind of lift off. There's going to be a little sticky range in there. Again, there is too much of a good thing. So if you feel like your fingers are trying to come off and you're really forcing them down onto the floor, you could end up causing more problems. So let your shoulder go through the range that feels comfortable and then see after you've done 10, 15 of them, has that range increased at all? Good. All right, we have a couple quick stability ones. I'm not gonna spend too much time because I've already taken way too long. But this is great for core work too. Any of your traditional core exercises that you do are definitely harder if you use them on the foam roll. Some people are familiar with like the dead bug series. So you've got arms up and you like extend one arm over your head so you can start there. You can then bring in leg motions with it. So as Cassie extends one arm, she's gonna flex one leg up. She's been practicing this. Don't fall, no pressure, Cassie. She's gonna
really concentrating.
She's gonna alternate, yeah, and this is good because what you'll see, it's for most people much harder on one side than another. We have a side that's a little bit more naturally stable than the other, and so you'll find that as you're doing it, maybe it's really easy on one side and then harder on another. And you can make this, infinitely more challenging in any number of ways. You could hold something while you're doing it. You could try to bring one leg up and then bring the other leg up. Maybe put your hands down for this one. So you can bring one leg up, then the other leg up. Oh, no, keep that leg up. Yeah, and then one leg down and the other leg down. You can start with both legs up in the air and then tap your toes down one at a time. So again, there's tons of progressions with this and you're probably familiar with a lot of them, but these are some options for you. If you have a foam roll, if you have one of the half foam rollers, I think we just have one here. It's a great option for balance exercises. So if you have a foam roll and you've decided after this that you're never getting on it again, this is another use for it. You can cut it in half and do balance work on it. If you are gonna do this at home, please do it in an area where you've got something that you can grab onto if you need to. So maybe like at a kitchen where you can just put your hands down on the countertop really easily. So again, that was some real quick and dirty introduction to exercises. I'd love to answer any questions now. If anyone has them, please feel free to type them in. Again, I know we went through a lot of that really quickly, so this is being recorded. Angela, I think, is gonna send out the link to everybody. So you can go through and practice them at your leisure. Feel free to email me if you have questions. Will I get my email?
I'll provide her email
Awesome.
for you.
So Angela's going to provide my email. So if you have any questions and you don't want to type them in now, you can feel free to put them in. Oh, I got one here. Can we share this link? Of course. Good question. So if you've recently pulled a muscle, can you foam roll that area? Sorry, this is going to get all tippy on me. Ooh. This chair's angled. Yes, you can. You can absolutely foam roll an area that's recently been pulled. Similar to stretching, you just want to be careful how aggressive you are with it. So just like a muscle that's been pulled, you wouldn't want to go through and stretch it really aggressively right away. You'd probably want to be a little bit lighter with the foam roll. So that might be an area too where I say start with a stick and then progress to the foam roll. Can we do some quick pectoralis rolling? Yes, Cassie would love to demonstrate that. So this is another one that's kind of awkward. I actually kind of like the theracane for this too. So we'll show that real quick because you can use kind of this knobby end of the theracane and use that for your pec muscles. Yep. Yep. So you can get in with the theracane or you can also use the foam roller. And this is just one that for a lot of people is a little bit awkward because it does involve being on your stomach with one arm over the foam roll. And similar to kind of how we did the lats, but this time you're gonna have your body angled like towards the floor rather than away from it. Thanks, Cassie. Mm-hmm. Anyone else have any questions? Awesome. Thank you guys. Thanks for being here so early in the morning. Again, if you have any questions, feel free. Angela's gonna send out the link. She'll send out my email. And thanks for being here. Everybody stay healthy, stay safe.
Thank you.
Thanks, guys.
Thanks.